Hi everyone, welcome to my YouTube channel. Myself I am Dr. Krishna. If you have not yet subscribed to my channel, please do subscribe to my channel. In this video, we are going to learn various anatomical landmarks and structures that are associated with the mandible. Let's get started. Here you can see the small green part, which is also called as mandibular symphysis. Symphysis is the fusion line of the two mechal cartilages and it usually closes after the birth. And here the small orange color representation is mental tubercle. Mental tubercle is the place at which the mental muscle attaches, and this is the alveolar arch of the mandible where the tooth sockets are present and tooth lies within that region. And here is the mental foramen from which mental nerve passes, and this is the small part called as alveolus. As I already previously mentioned, this is the base of the mandible and this is the body of the mandible. Here is the external oblique ridge of the mandible, and this is the retromolar fossa. Retromolar fossa is present distal to the third molar region, and this is called as retromolar fossa. And here is your masseteric muscle attachment. This is called as masseteric tuberosity, and this is the angle of the mandible. This is the neck of the mandible. Here is your coronoid notch, or it is also called as mandibular notch. The coronoid process, the place where temporal muscle will come and attaches to it, and this is the ramus of the mandible. Till now it is clear, right? Let's go to, this is the lateral surface of the mandible. Now let's see the medial surface of the mandible and its contents. Here you can divide it into two places, that is the body of the mandible and also the ramus region. Ramus region you can also subdivide into lateral side and medial side of the ramus region. First let us look on the medial side of the ramus region. This is already I mentioned the coronoid process, and this is the mandibular notch. This is the head of the mandibular condyle. Okay, this is the head of the mandibular condyle, and this is the pterygoid fovea where the pterygoid muscles will come and attach in the pterygoid fovea region. And here is your temporal crust where crista temporalis, it is also called as crista temporalis mandibular, and this is already I have shown from the lateral aspect. This is retromolar fossa, and here is your mylohyoid groove, and this is the mandibular foramen. From the mandibular foramen only your inferior alveolar nerve and vessels will pass. Okay, and this is the pterygoid tuberosity. This is submandibular fossa. Submandibular fossa means here the submandibular gland will be lodged in this region, and this is mylohyoid line. Here you can see this is sublingual fossa. Sublingual fossa is the place where your sublingual salivary gland will be lodged, and submandibular fossa is the place where submandibular salivary gland will be lodged. And here in the center you can see two genial tubercles. Two genial tubercles can be seen. Okay, these genial tubercles have attachments for the genial muscles, and this is the digastric fossa. Digastric fossa will give attachment to the anterior belly of digastric. This is all about the medial surface of the mandible. You are now clear with the medial and lateral surfaces of the mandible. Hope this content will be helpful and useful. Make a note regarding the age changes of the mandible. During the childhood, the angle is obtuse. It is 140 degrees or more. It is because the head is in the line with the body and the coronoid process is large and projects upwards above the level of the condyle. During the adulthood, it is 110 to 120 degrees because the ramus becomes almost vertical. And during the old age, the angle again becomes to 140 degrees because the ramus is oblique. These are the three reasons you should learn, and also the angulations as the age progresses. Thank you all. Hope you all loved the content.